How is it that the wealthiest country in the world has such a screwed up healthcare system? After 35 years in the healthcare industry, I decided to retire and share my secrets with you. I'm Chuck Melendi, and this is Disruptive Dialogue. Hello, Disruptors. Welcome back to Disruptive Dialogue, where we bring you the information that you need to be an informed consumer of U.S. healthcare, as well as providing insights to what's hurting our healthcare system and how we can make it better. I'm super excited today because we're going to focus on insurance options for our senior citizens. Now, we all know that when you turn 65, you become eligible for Medicare, which is the federal program that offers healthcare to seniors in our country. We're going to walk through two programs, Medicare Advantage and traditional Medicare, and provide you with an overview of what you need to know when you turn 65, the pros and cons of each program, and which one might be best for you. I'm excited because nobody knows everything, and I've brought on two experts today to the show to discuss these two programs. Chet Pietras, and y'all might remember him because he was in a previous episode, is an insurance agent who's been helping patients choose the right insurance coverage for over 40 years. He has experience in all lines of insurance, but the last 15 years, he's really focused on healthcare insurance for people of all ages. Our other guest is Ethel Owens. Ethel's an office manager for a large physician practice. She's been focused on the financial side of healthcare for 40 years as well. She's a past president of the National Organization of Rheumatology Managers, and she's involved in advocacy work for an organization called ATAP, which is the Alliance for Transparent and Affordable Prescriptions. As you all know, I'm old too. I've been doing this a while. Between the three of us, we have over a century of experience in this area, so hopefully we can bring some insights to you. And I do believe that over the next 45 to 60 minutes, you will gain a better understanding of these two programs. And I know there's confusion out there. And I also hope that after you hear this discussion, that you'll have a better understanding of which program works best for you or for your parents or for someone that you know that is 65 or older. With that, Chet and Ethel, welcome to the show. Now, before I get started, and I gave you all a quick intro, is there anything I need to add to what I said?
We're just here advocating on behalf of patients.
I know. That's why I have you two on here. You're two of my favorite people and incredibly knowledgeable. So as you both know, I asked you to come here today to provide different perspectives for these two programs. I often hear people say that they or their parents are confused as to which program they should enroll in. As we all know, that answer usually starts with, it depends. So no one program is best for everyone, as we know. People with different lifestyles, different financial means, different health issues, among other things, will help determine which program is best for that person. Both of you also know that things change as we get older. And while you can switch from one program to the other, and most people don't know that, there can be some challenges if you do that. So viewing these choices as a life choice, both in the short and long term, is imperative. And I want to reinforce, as we've said throughout this summer series on health insurance, this is a huge decision. Pretend this is like you buying a house or buying a car. You have to do your homework. You can't wait till the last second. And you need to engage with professionals who know what they're doing. So with that being said, let's get started. So I'll start off with, Ethel, I'm going to start with you real quick. I said I was going to do this, but I'm going to let you do it because I've already talked too much. So I know that there's 4 parts to Medicare. So can you just give a quick, brief overview of the 4 different parts of Medicare?
So as Chuck alluded, when we turn 65, we need to start making these decisions, but the time actually starts clicking a little bit before that. So the first thing you need to do is, if you're still working, you still need to enroll in Part A, which is the Medicare hospitalization coverage, and that's for inpatient hospital stays, skilled nursing facilities, hospice care, and then some home health care that may be available. The Part B is the traditional Medicare that was enacted. I think it was in 1965. It's been around. That program's been around for a very long time. And that includes the Part B, which is your physician's coverage, is anything outpatient. If you have surgery, it's outpatient surgery, things like that. It's any preventative care that you get at your physician's office, it's your well visits, it's all of those things. And then we come to the Part C. And Part C was a new program that was introduced in 1997. It was part of 1999. It was actually part of the Balanced Budget Act of 1997. So these programs have been around for a very long time. And the Part C actually combines traditional Medicare A, which is the hospital coverage, the Part B coverage, which is outpatient and physician service coverage. And then many of them also for C include your prescription coverage. So that would be any at your specialty pharmacy, it would be any at your mail order pharmacy or at your local pharmacy. And then we have coverage of what we call D, which is prescription coverage, which is sometimes rolled into C, but it's separate from A and B. So those are the four different programs that you need. We also have a fifth one as well, which is a commercial program that we buy as we come into Medicare, which is called supplemental policy or gap policy. So that helps cover some of the out-of-pocket expenses to Part A and Part B.
Ethel, thank you so much for walking through the different parts of Medicare. And just a heads up to everybody, you'll hear, okay, what's traditional Medicare? What's Medicare Advantage? And there's all kinds of things. My mom and dad used to have Medicare Advantage through United Health Group, but it was known as AARP. It's very confusing. But just know, if you're doing traditional Medicare, basically that's funded and run by the federal government, and that's Part A and B, which Ethel talked about. And then if you want drug coverage, you're going to go with a PDP or prescription drug plan. If you're going through Medicare Advantage, which is funded by the federal government, but run by private carriers like United, Aetna, Cigna, et cetera, then that's called Part C, also MAPD. So MA, which is Medicare Advantage, and PD, which is prescription drugs. So just a little clarification. Now, one other piece, Chet, if you could help everybody, is we have coming up open enrollment, which means for everyone looking for insurance, no matter your age. But there are some special things with when you're turning 65. Chet, can you help everybody with that?
Absolutely. Thanks for the opportunity, Chuck. So open enrollment runs each year from October 15th to December the 7th. So during that window of time, anyone that's on a Medicare plan, whether it is with original Medicare or with currently a Medicare Advantage plan, that's the time period with which you can make a change for the upcoming year. So it's important to understand that that's the only time you can make that change, typically. There is another enrollment period I won't get into. The open enrollment period starts in January, where if you went into a plan, you can make one more change into a like plan. But again, for most people, it's easy to understand that October 15th to December 7th period of time would typically be the time that you'd want to examine how effective your plan was in the past, whether it's the past year or longer, if changes have been made. Plans change from year to year big time, along with the drugs that they cover. So that is the time of year that every single person that's on a Medicare plan needs to consider changing if that's prudent in your situation and consulting with your agent.
Now, Chet, is I don't know if you covered, maybe I missed it. There's when you turn 65, isn't there like a 6-month window where you have to go into Medicare? You have to sign up, or can you clarify that for me?
Absolutely, Chuck. Great question. So there's actually a 7-month period. It starts 3 months prior to the day month of your birth. So, for example, if you were born in the month of November of any year, and you're going to be 65, your initial election period with whatever plan you're going to go with, whether it be original Medicare or a Part C Advantage plan, that period starts 3 months prior to November the 1st. So 3 months prior, the month of your birth, in my example, November, and then 3 months after that. So in that 7-month run, you need to make a decision as to which way you want to go and what plan you're going to utilize for your coverage moving forward. Great question, Chuck.
Awesome. Thank you so much. I just got to say before we keep going, I wish I had Chet's voice. He's got a voice for radio, man. You got that big, voluminous voice. I mean, either that or I need an English accent to give me some more credibility, but we're not going to worry about that today. So, Chet and Ethel, thanks for leveling the playing field, telling us what people need to do. And everybody, as Chet said, open enrollment for Medicare starts October 15th. You need to start doing your homework now. So talk to your doctor's office, talk to your agent. If you don't have an agent, you can get an agent. And someone like Chet, you can go online, look for them. In my previous episode, we talk about how you do that by state. It doesn't cost you anything. They get paid by the carrier. So make sure you get some. You don't go buy a piece of real estate or a house without a real estate agent. No reason to try to get your insurance or your Medicare without an agent. Okay, off my soapbox. Now, Chet, you're the first one up for our questions. So we want to talk about what's best for everybody, and everyone's different. So we're going to start with cost and affordability. These days, we're all worried about cost of eggs, you name it, but healthcare is getting crazy. So Chet, which type of patients would normally save money going with Medicare Advantage versus traditional Medicare or vice versa? And I know this is general and there's exceptions, but in general, what would you say?
In general, I would say that if you're relatively healthy, the first thing I would consider would be your current health situation. We can only make decisions on what we're currently faced with. So if you are relatively healthy, you don't have any, significant or chronic medical conditions you're dealing with, then certainly I would consider, for sure, looking at a Medicare Advantage plan for enrollment. The reason I say that, of course, is because under an Advantage plan, you don't have a separate premium in addition to the Part B Medicare premium that we all pay to have to contend with on a monthly basis. So yeah, if you're going to be relatively healthy, make sure that your doctors take that plan for sure that are in what's called the network of doctors. That would be a consideration. The other thing is certainly if finances are a problem regarding your current retirement situation, that's another thing you need to factor in because you're paying that additional premium to cover what original Medicare doesn't cover if you stayed in original Medicare rather than going to a Medicare Advantage plan. And over a 20-year life expectancy period or longer, please do the math. That's a pretty big number for you to take into consideration. It certainly should be a consideration. So if you're relatively healthy, I would certainly look at a Medicare Advantage plan as one of the options you may want to consider moving forward.
Thanks, Chet. And now one other question for you, Chet, and we're going to stay with cost and affordability for the moment. If a patient did go with traditional Medicare, how important is that they would get a Medigap option, especially to add financial predictability? Because my understanding is Medicare Advantage has an out-of-pocket max. I think it's around $8,000, but traditional Medicare does not. So that Medigap or supplemental Medicare insurance comes into play. Could you expand on that a little bit?
Yeah, sure. So Medicare supplement plans, there's about 12 different plans available. There's variances of that, but a base of 12 plans. The highest plan you can get today is called a G plan. They retired 2 other plans back in 2020, a C and an F plan you can't buy anymore unless you were 65 before 2020. So a G plan today with most of your major providers is going to be a little under $200 a month, give or take, depending on the carrier. So that's a pretty significant amount for a lot of folks hitting 65, especially if all you're looking at is Social Security along with a limited, perhaps additional income. Now, $2,400 a year And if you have to then also purchase drug coverage, because original Medicare and the supplement do not cover drugs at all, you need to pick up a separate drug plan. That's an additional expenditure that you would have on top of the $200 or close to it, and the Medicare Part B premium, which, by the way, is a proposed increase for next year. That Part B is going up 11.6% to $206.50 a month. So by the time you add all those numbers together, for a lot of folks, it can be a considerable amount of money. Certainly for one person, much less a husband and wife, that you're putting out for all the years moving forward. So again, those are the considerations I would say you'd want to look at.
Yeah, it's definitely, to your point, if the financial piece is super important to you, if you're fairly healthy, then Medicare Advantage really and truly, from a cost perspective, has some significant considerations to think about. Ethel, anything you want to add to that?
Chet did a great job of that overview. With the traditional, you also have your deductibles. You talked about the premiums, but there's deductibles and all of those. And as you look at the HMO and PPO, do the math and figure out what your out-of-pocket max would be, because all these programs have out-of-pocket annual maximums. We also have our Part D deductibles, and then you have your Part D coinsurance. So there's a lot of cost associated with this. If you're fairly healthy, hopefully you'll never have to navigate this maze that we do. But if you do, there's great resources out there, folks like Chuck that are agents that can help you navigate through this system. And that's, I think, the intent is really just to educate our patients and let them know there are options.
Yeah, and once again, I think that at the end of the day, everyone is different. Chet also mentioned, look, this is a really good consideration if you're fairly healthy, but if you're not, you do need to realize that if you're having to go to the doctor's office a lot, if you're having to go into the hospital, a lot of that is covered quite a bit by Medicare. There is much more you will pay out of pocket with Medicare Advantage. So there is no perfect plan, but I think that that's a very good guideline to start with. So Ethel, we talked a little bit about cost and affordability with Chet. Let's talk about access and choice for patients and providers. So how does provider access for patients differ, if in your experience, because you're at a physician's office, between traditional Medicare and Medicare Advantage?
Well, I think Chet alluded to this as well, Chuck. It's important that you look at who your physicians are, see if they're in network. Look at your area hospitals that you want to go to. Make sure that they're in your network. If you like to go to LabCorp or Quest, make sure they may be the preferred in network. Because remember, when you're going with Medicare Advantage, they're going to, kind of have parameters of what access to healthcare you may have in your area. If you go with traditional Medicare, it's open to anyone that accepts Medicare. I think with traditional Medicare, if you are a patient with chronic disease and you have a lot of different specialists and you need a lot of services throughout the year, if you're a person that's perhaps going through a cancer treatment or something like that, you want to look very closely. And that's, again, why we recommend that you work with an agent, you understand what your healthcare needs are, and you become your own healthcare advocate. If you're with a physician that's not in network, say if you choose a Medicare Advantage, find out what the cost is. If you have a Medicare Advantage PPO, you actually do have out-of-network benefits. You may have a higher out-of-pocket cost, but the insurance company would cover some of that cost. If you have an HMO, many times you do not have out-of-network benefits, and that would need to be, a decision that you could make up front. As we alluded, one of the great things is if you make a choice and this is not the best choice for you, whether you choose a Medicare Advantage or traditional Medicare, you have open enrollment again next year and you can change. So when you're signing up for this, really you're kind of signing up for a year. It's even kind of a test period to say, is this what meets my needs? And if it's not, keep a list of things that you want to research better next year, because in fact you may not. But as we start to age, we need more healthcare professionals helping us. And it also depends on what plans are in your area. I know that I had gone on and did some research on this. And I have over 69 plans in Palm Beach County that are offered for Medicare Advantage plans. So I don't even know how Chet goes through all of this and says, what's best and what's not best. In addition
He doesn't
to
sleep, Ethel. He
no,
doesn't sleep.
right. And then also what we need for our secondary and our pharmacy benefits as well. But cost is a factor, and choice, it's great that we do have choices. And that's really what we're looking for. We're looking for access. We're looking for affordability. Those are the two key players here, because if you have affordability and you can't get, you took the cheapest plan, but there's nobody in your area that can fit you in, or you have a 6-month waiting period for a primary care, or primary care has closed their network to Medicare Advantage patients, you're stuck. So these are things that you want to make sure you do your homework, that you research it well. And I'm in South Florida as well, and we do have, a lot of Medicare Advantages, and they do work for folks. And it's sometimes comes down to affordability issue. And sometimes you simply don't need healthcare. Why pay the high premiums and things like that if it's nothing that you're really going to consume? We are consumers. If you don't need it, you don't need to have it. But on the flip side, there are people that have special healthcare needs. And that's where it's really important to work with an agent to go through and figure out if you're somebody that travels, what happens if you travel a lot within the nation or, internationally with your healthcare coverage if you have a Medicare Advantage? These are not questions that you want answered when you're on a trip and all of a sudden something catastrophic has happened. If it just is peace of mind and ease. But again, it's also affordability.
Right. So thank you, Ethel. And so Chet, on the flip side, back to you, if I'm sitting here and I'm a fly on the wall and I'm like, wow, this sounds like probably I want to go with Medicare Advantage. Although, Ethel, to your point, if you're going to travel, that could throw some things in there, but you could get travel insurance, et cetera. Chet, I do hear in the news, Medicare Advantage plans are stepping out of certain markets, or they're dropping certain physician practices. I have a brother-in-law who's an orthopedic surgeon, and he just lost a huge carrier in the state of Florida. And so obviously those patients who have that Medicare Advantage plan, they would lose him as a physician, so they would have to switch. So expand on that a little bit for me, and what patients should look for, what they can do, et cetera. Once again, there's no one deciding factor, but that's something I think people need to pay attention to.
Absolutely correct, Chuck. Look, I've been doing this a fair amount of time, and you always pay a price. If you have the money, I'm just trying to give everybody an overview here on all this information. If you have the money to pay for a supplement and a G plan, if you're just turning 65, by all means, that's the way you want to go. That's going to give you maximum freedom, no networks to worry about, no pre-authorizations per se, at least in the current climate, to worry about.
Yeah.
No referrals to worry about. It gives you the greatest amount of freedom medically that you can possibly have today. So that's the way you want to go. But all of us don't fit that issue. As I said, over 60% of the enrollees today in this state are going Advantage, probably either for health reasons or financial reasons. So if that's the case, you brought up a great point, Chuck, addressing your question. Networks, that is the plans that doctors are contracted with to accept their payments. They change all the time. Okay. If anybody tells you differently, they either are ignorant or they don't know business or haven't been in it a while. What's going on right now with two major providers, and I won't mention the names. You guys probably know one of them at least. There's a lot of constriction going on across the state where they're either in their contract with the physician. There's actually two hospital systems involved with one of those carriers. So that's one of the prices you pay, if you will, by being in an Advantage plan. You could be in a situation where you're losing your primary or you're losing a specialist that you absolutely want to keep And again, look at it this way. If you're with a supplement, paying all those dollars, you don't have that issue at all. But in an Advantage plan, all carriers change their provider networks on an ongoing basis. The doctors can drop out and the companies can let them go as well.
Yep.
So those are considerations you have to take into play when you're in a Medicare Advantage plan.
Thank you. And I'm glad you pointed it out. It's not just the carriers, although if you listen to my podcast, I usually go after them, but also physicians can drop out. Maybe they don't like the reimbursement they're getting from a carrier, or right. Even they don't like what Medicare pays them, and they'll drop out of that. Look at dermatologists. Most of them take cash. So, there's a lot to think about. So, Chet, another question for you. We're talking about patients, financial, also if you're really healthy, but patients with high medical needs. Does Medicare Advantage provide real financial protection for those patients with catastrophic health needs? Because obviously you have a cap, et cetera, or traditional Medicare plus Medigap. Which one do you feel might be a better option, or does it depend? What's your thoughts?
My thought is this, that if you have chronic medical conditions today at your current age, that's logistically only going to get more pronounced, statistically speaking, as we age, whether it's your medications or the medical treatment that you're receiving, at least what I've seen over my decades. So if you can afford, not just today, I'm looking at I always plan with my clients over the long term. They need to understand what they're looking at in terms of expenditure over maybe a 20, 25-year period based on life expectancy. If you can afford to go with a supplement and stay on original Medicare, that would be my recommendation. No question about it. Okay.
Yep.
If the financial outlay to go in that direction is either causing you additional stress, or angst, as I call it, then we should consider then a Medicare Advantage plan to alleviate that stress, if you will. Now, the price you're going to pay we already covered it. The network may change. You may lose a doctor or a hospital system even. And secondly, what comes into play there with a chronic medical condition is going to be what is the MOOP, the maximum out-of-pocket that the plan provides. That's the amount, including no matter how much you pay, whether it's a flat stated copayment, like a specialist at $45, or a hospital stay at maybe $325 a day for a few days, you're going to put out that money more than likely if you have a chronic medical condition during the course of the year. So the maximum out of pocket is the most you can be financially exposed to during that year. And typically what you'll see in the industry is the HMOs are significantly less because there's more restrictions on an HMO compared to a PPO. And a PPO, of course, is going to be higher. So typically you'll see an HMO somewhere around, let's say, $2,000 to $3,000 maximum out of pocket in a given year, where a PPO would be, say, $5,000 to $7,000 in a given year. That's a very realistic range of numbers. And that is, again, the most that you should be financially exposed to in a given year under that plan.
Chet said maximum out of pocket, or a MOOP, basically means, and y'all correct me, but I think that's outside of premiums, is you do not, there's a ceiling on how much you can pay. Traditional Medicare does not have a ceiling. So you could go over that, which is why if you go traditional Medicare and you have a lot of healthcare costs that you believe are coming, you better have that Medigap policy. So Chet, you mentioned medication. Ethel, I want to come back to you. Boy, drug costs are in the news all the time. And heads up, everybody. Yeah, I used to come from that. I do not protect those people. I do not protect my old industry. We have some skin in the game and fault there, although realize medications are only 18% of total spend in the country. But let's talk about medications, Ethel. So drug coverage and formularies, they're going to play a role in whether you're going to go Medicare Advantage or you're going to go traditional Medicare. Give us some real world situations and what's happening there. And what makes choices?
Yeah, there's two categories of the drugs and these two programs that we're talking about, the Medicare Advantage and the traditional Medicare. The first is the pharmacy benefit. That's something that you're getting through your specialty pharmacy or point of contact at your pharmacy or mail order. And those will have, a deductible, and then you will have co-insurance after that. So typically the deductible for Part D currently can be up to $615, but the maximum out of pocket is raising to $2,100. So currently it's at the $2,000 mark. So that's, your deductible plus your maximum out of pocket on that would be the $2,100. And Medicare created a great program for that, whether you're Part D or, traditional Medicare, A, B, or C, that this prescription drug coverage program comes in. They did something where you can actually sign up to Medicare. You have to go to Medicare website and you can decide, say, if you have a drug spend of $1,200 in January, you can actually go in and sign up in January on the website and transition those payments over the certain months in that calendar year. So that's something that, you should look into but either way, your prescription coverage is your prescription coverage. There's a deductible, there's a co-insurance, but when Chet was talking about the maximum expense, it would be $2,100. And then under Part C, sometimes your programs, your drugs may be cheaper, but what we run into, I think you were alluding to, is the tiers or the classes of medication. So sometimes you may have a copay of X amount of dollars if it's a tier 1, 2, 3, 4, or 5. I think they've gone away from the tier 5s and we just have 3 to 4 tiers now. But those are, copays that patients have to pay before they pick up their prescription drugs. We do also have GoodRx, which I recommend to all of our patients out there, whether you're under commercial or you're under any type of Medicare program. Go online and see. You can sometimes get your prescriptions for $3 or even free, but there is prescription drug coverage. The second piece is the in-office administered drugs, which is under Part A in the hospital, Part B in a physician's office, and Part C either place because your C covers A or B. And many times that's rolled under the physician services or the hospital services into that deductible. So there's no separate. It's just a covered services after you've met your out-of-pocket expenses or co-insurances, and then the insurance company should be covering it 100% after that.
So Ethel, real quick question for you, because I thought that with the Inflation Reduction Act that the out-of-pocket max for Part D for your drugs was going to be $2,000 outside of your premium. So is that going to $2,100?
That is this year for 2025, and that is actually been released. Some of the other information for 2026 hasn't been released, but they did say that the proposed is to have a $2,100. So that would be a $100 an increase, $100 increase.
Right. And so just a couple extra things to add to that. So that does not include your premiums. So if you're paying your monthly premiums, and we talked about this in the last episode, that does not count towards your maximum out of pocket. But if you're a high utilizer of especially expensive medications, that $2,000 or $2,100 cap is going to be huge. One other thing that I will throw out there, and this is from my old job, is that the health plans and the manufacturers are paying more for that Medicare Part D program moving forward. The government's going to pay less. That's how they're going to save money. However, there weren't a whole lot of guardrails put up on insurers being allowed to increase the premiums due to that. So because they're paying more in the catastrophic area, we have seen premiums increase. And I will tell you, what I have noticed is premiums increasing more for the PDP or prescription drug plan, which is the drug benefit for traditional Medicare beneficiaries, than for the drug benefit for your Medicare Advantage. So once again, another thing to talk to your physician's office and to your broker to find out what's best for you. So Chet, I saw your picture out. Are you still with us verbally?
I hope you can hear me verbally. Can you hear me?
Boy, I hear that WKRP voice coming loud and clear. So thank you. So Chet, anything you want to add when it comes to drug coverage and that kind of thing that we touched on?
No, you hit on a good point. I was at a meeting on Tuesday with a large insurance provider in the state of Florida all day, and I was shocked to hear that 40% of their outlay this past year was in drugs. that of their, of the money they allowed, it's way higher than they ever thought it would be. So we're definitely going to see some major changes on the drug side of the board. Fortunately, Medicare only allowed the maximum out to go up $100 for them. So what they did to mitigate that was, in most of the plans that I've seen so far, is they've either added a deductible where the client's going to pay a deductible for their Part D prescription drugs, or if they had it before, they've increased that deductible. So they're gonna pay more upfront, but still the maximum out of pocket is only $2,100, everything included, including that deductible for 2026. So that's the only consideration that I could bring to the table.
Okay, awesome. So Chet, you talked about different factors. I hear a lot in the news about rural area, patients in rural areas. And quite honestly, we are seeing, a lot more low income people, and they're going, you see them all the time working at Walmart, taking odd jobs as they get older. Do you think there's a difference in experience for patients in rural areas or lower income between the two programs, or things that they need to consider, or do you feel like we've already kind of touched on that?
Well, the only thing I would say is you go back to making sure that you're working with a professional that's experienced, and if you're going to go, if you can afford to do the supplement, go with the supplement if you're in a rural area. Okay, no question about that. That way, any doctor that accepts original Medicare, you're covered. You're good to go. Again, the supplement will pick up anything. With the exception of the Part B deductible under a G plan. And remember that you still have that deductible that has to be met under Part B of original Medicare, even with a Plan G, and that deductible is going to $206.50 next year. But other than that, your medical coverage is service-wise is covered in full, and there's no network to worry about. If you're going to go with a Medicare Advantage plan, that's where the agent really needs to make sure that the network that the provider is offering you in this rural area has enough representation to meet their needs.
Over
I
for a
just want to
sec.
say too, for the dual
Yes, sorry.
eligibles and the, some of the folks that don't have as much money, there are other low income subsidies that are available to help patients. And there's also what we call dual eligibles, which is more of a Medicare, Medicaid coverage but this is something patients would have to get involved in to submit their financials to see if they qualify. But there is help out there for folks sometimes. And Chet alluded to this, what may prohibit that is if they don't have providers in their area that take their plans for what they need. Many people can't travel 50 miles to go to a doctor. It's just not sustainable.
And we're not going to get into dual eligibles, but to your point, Ethel, that is something that is available. If I may qualify for Medicaid, they can have Medicare and Medicaid. That helps out with low income. But Ethel, let's go down people with chronic disease, or people who have, like complex conditions, maybe cancer, rare diseases. Give us, from a physician and all the patients you see, high utilizers of medical services, Medicare Advantage versus traditional Medicare. What are some of the challenges, like prior authorizations, things like that they just need to be aware of?
The advantage of traditional Medicare with the supplemental policies that we talked about, and the pharmacy, traditional, pharmacy policy as well, is the easiest way to go. If you don't want to get prior authorizations, if you don't want to get a referral from your primary care, if you don't want to wait, or if you want to get on, whatever you want very quickly, it's usually very, very smooth sailing for traditional Medicare with a supplemental. If you go with a Medicare Advantage, many times, it takes a little while to get the referral, because, sometimes even with the PPO, you have to have somebody referring you in. You don't necessarily have to have a referral, but you have to have a referring in. Getting access to labs, getting access to testing, getting, access to things. It's usually when you have like an acute situation where time may lag. If you have a chronic situation and you're, on therapy, and, things have been worked up, and you know what your diagnosis is, and you know what your treatment options are, then you're probably going to have smooth sailing. Affordability is always going to be an obstacle. We have a lot of biosimilars now too. Formularies change every quarter now with commercial carriers, and commercial carriers are managing Medicare Advantage. So you have a lot more rollover from the commercial sector on Medicare Advantage as far as restrictions and access. And I don't want to use the word delays, but honestly, it is delays. It just takes additional times. There's different steps. And even with my Medicare Advantage, a lot of times my Medicare Advantage, really, those folks cannot afford their copays for their treatments. And that's where, problems lie. We know under our commercial sector, there's copay support that patients qualify for. Under traditional Medicare or Medicare Advantage, there's not. So sometimes if you have a chronic disease and you look at your out-of-pocket expense, you can almost pay your Medicare premium, your supplemental premium, for the amount that you may have to pay out of pocket on a traditional Medicare Advantage. When you think you have Medicare Advantage, you think you may not have to, but you may not have to pay anything out of pocket. But in fact, even with the Medicare Advantages, you could have $4,000 or $5,000 maximum out of pocket, which you guys spoke about. And if you have chronic disease, you're probably going to spend that. You're just going to spend that because that's what you're consuming as a consumer of healthcare. So my best advice is to understand what your costs are, not just what your point of contact at the pharmacy or at your doctor's office, your copay, but what is my overall care cost and what do I have available to me under a Medicare Advantage HMO versus a Medicare Advantage PPO versus traditional Medicare. I think traditionally Medicare, if you're ill and you could afford the premiums, that's probably the least stressful way to go. But if financial situation does not allow for that, the financial burden and stress could be exorbitant. You really have to understand your finances and where you're at this point in time. You might start with one at this point in time and transition. It's really very patient specific.
Yep. So thank you, Ethel. And Chet, anything that you want to add that we should know around that whole piece?
Here's what I would say, and kind of like a closing statement when it comes to this decision, such a big decision for a lot of our fellow Floridians, and it's this, or anybody in the country. If you have a chronic medical condition that you're dealing with right now today, then you really should go with a supplement if it doesn't pose a financial burden to you and your family. And that's the bottom line. Okay. That's how I see it anyway. If you do not have any chronic medical condition you're dealing with today, and I know things can change. I've seen a lot, but if you're not, then I would recommend looking at a Medicare Advantage plan, a Part C plan. And again, I'm just going to give you my personal view on this. I steer most of my clients, and I have a few hundred Medicare clients, away from the HMO side of the board. I'm not a big believer in the HMO side. And the reason for that is because the networks change even more often in HMOs based on what I've seen over the decades. They're narrower networks, okay, to start with. You have no out-of-network coverage if something did change in the future. You're paying for everything out of network. And to me, and you have to get referrals, okay, to see a specialist. So to me, the restrictions and limitations in an HMO is just something I don't want my clients to have to go through in the future. So I would look as an alternative to original Medicare with a supplement. Look, if you're going to go Advantage, for the reasons stated, look at a PPO plan, okay? Because it gives you, even though the insurance industry is involved, and I hate the insurance industry, and I've been in it for 40 years, but even though they have less of a stay and you have more flexibility with your coverage in a PPO than an HMO. I guess I can leave it at that.
That's awesome. So as you said, we are closing in on the end. So I've got two more questions. So I'll give you each 30 seconds to handle these two questions if you're okay with that. So Chet, I'll start with you. You mentioned, the Medicare supplement, the Medigap, and for patients to do that. But as we both know, especially if you start in Medicare Advantage and you try and switch down the road, say an illness hits or whatever, and you go to traditional Medicare, to get that Medigap or that supplemental insurance, it's not guaranteed that you can get that. So Would you like for Congress to consider expanding Medigap for all patients, requiring insurers that if they're going to participate in Medicare Advantage, this is my magic wand, that they would have to also accept patients for Medigap policies? Do you think that's something that would be helpful? What are your thoughts on that?
Boy, that's a good question, Chuck, and you're absolutely correct. After your initial election period, which at the beginning of our segment, I talked about that 7-month period when you first go in to Medicare eligibility, that is the only time that a Medigap, that's the old term of it, Medicare supplement is what it's called today. That is the only time that they're guaranteed to be issued, irrespective of any health condition. Period. End of story. It's a guaranteed issue. Once you get beyond that period, all carriers will quote medically underwrite, meaning you're going to be asked medical questions. They're different with every carrier. Some carriers you may qualify for, others you won't. And I think you personally experienced that in your own family situation, Chuck.
Yep.
So yes, and you may not be able to get any Medicare supplement depending on what you're going through when you're trying to get it. And the industry realizes that. Why do people look at going to a supplement? It's because they're combating a major medical change like an internal cancer situation. And they don't want to have to be forced to take that risk on, knowing they're going to be putting out a ton of a supplemental money to handle that radiation or chemo or other medical conditions. So to answer your question, I would love to see a guaranteed issue situation from someone coming out of an Advantage plan to a supplement. Do I believe we're going to see that? I don't think so. I think the industry will point that tooth and nail.
Yes, they will. Ethel, anything to add to that? Or
No, I think well said. I think even on those, the other thing is they do pre-existing. So they'll do a carve out on the pre-existing. Even if they write the policy, you may have to wait 1.5 years to use that benefit. So well said, Chet. You definitely know your business. You're there for you're there for your customers, and we need more like you out there.
Thank you, Ethel. That's very kind of you to say that. I appreciate that.
Well, and I do want to say, Chet, you mentioned this, and this is for everyone to know. I actually talked to someone recently. My mom, I moved her into a independent living facility not long ago, and she was with Medicare Advantage, and we found out when she had to go to PT that they didn't accept Medicare Advantage. Mm-hmm. They only accept traditional Medicare. So if you have a parent or if you are someone, you're moving to a facility that independent living, et cetera, make sure you know what they accept because you don't want to be caught not knowing. And this is another thing to think about. So last question for you guys. I'll start with Ethel, 30 seconds. And I know that we've touched on this a little bit, but I'll just, so we can bring it top level. If you were advising someone that you knew that was turning 65, what are the top 3 factors that you would tell them to weigh when they're thinking about Medicare Advantage or traditional Medicare? Ethel, I'll start with you.
So number 1, I'd say affordability. If you can afford traditional Medicare with the supplemental policy, you're going to be covered. You're not going to have any of this pre-existing if you need to go into that program if something catastrophic happens. Number 2 is I would look at your community, see where your providers are, look at the list of doctors, look at your hospitals, and make that determination. And number 3 is even if I chose not to do the traditional Medicare and I decided to go to a Medicare Advantage, I would steer away from the HMO if you have any type of chronic disease.
Awesome. Chet, you're 3.
Boy, I think Ethel and I have pretty much see eye to eye on this. I know we didn't do any preparing on this, but I wrote those down as you asked it, Chuck, and I concur with a lot of what Ethel has already said. The first thing I would consider is your current financial and future financial consideration, the outlay you're going to put if you go with a supplement. And again, I didn't mention this. I know I said it on a prior discussion we were on, but you're looking at over 20 years for a husband and wife, about $127,500 just in supplement payments over 20 years, give or take, based on a 2.7% inflationary rate, which is what Medicare supplements have actually averaged based on my studies. The second consideration would be your health status, equally as important as your financial. If you've got a health situation going on that's chronic or you want to be, and if you can afford that supplement, absolutely positively, you want to go with a supplement. And the last thing I would say, inform yourself and prepare yourself, for crying out loud. We spend more time preparing for a party or a gathering or a vacation than we do our health insurance needs moving forward, it seems like, to some of the folks I've met with in my career. Spend a lot more time informing yourself and getting ready to make the correct decision for you and your family moving forward.
Awesome. Awesome. So before I wrap up, is there anything either one of you would like to add that maybe we haven't touched on that you want to leave the listeners with before we close up?
I think there's a lot of resources out there. You had mentioned Chat GPT. I think that if you go in and just enter something in there, put in your zip code and see, what's in my area, list out some of your chronic diseases, things like that. Become your own healthcare advocate and reach out to an agent, as Chet is. There's also government agencies in the state of Florida and your own state throughout the country that can help you with this. This is complex. It is decisions that you're making, and sometimes, we will not know what we purchased until we go to use the product.
Thank you, Ethel. Chet, anything you want to add?
Yeah, pretty much on the same line. I would say that I would, if I was a lay person out there without my experience, I would want to team up with someone that's is knowledgeable and working with Medicare for quite a long period of time, and make sure that you cover all the bases, whether it be the network of physicians, the type of plan it is, maximum out of pocket, all of the details that would be important if something were to change during the course of the year, and make sure that that agent can also assist you in the future, that they're not here today and gone tomorrow. If you can get someone that's local, at least in the state of Florida, that's been doing this quite a while, because they don't, as you said, Chuck, they don't cost you anything. It's not like you're paying an additional fee of any type for that guidance and assistance in making the correct decision on your health coverage moving forward. And if you have any questions in the future, my clients call me all the time and say, "Hey, Chet, what should I actually expect to pay for this under my plan?" And they have that information. I send my clients a summary of benefits on every case and an EOB, an explanation of benefits, a very detailed overview of the plan. So they have those documents, but I told them to call me anyway. But that's what I would say in summary.
Awesome. Well, in closing, first off, I'm so thankful for both of y'all coming on today. I know that, you're both busy. You both have things going on. You took some time out of your schedule to join us today. I realize when people are going for health insurance, especially as we get older and we're turning 65 and we're dealing with Medicare Advantage, you get all these commercials coming, Joe Namath and Joe Montana come talk to us on TV. People should be able to walk away from this knowing when to enroll. It's coming up soon, everyone. How to prepare ahead of time. And that they should try to find an agent, work with an agent in your area, or talk to your physician's office if you have a physician's office that you go to all the time, and do your homework. For everyone listening, you can go to disruptivedialogue.org to find the show notes for today's episode, as well as a bunch of PowerPoint slides. Yes, I'm an old pharma guy. I still do PowerPoint slides. I have a bunch of information in there that I've put together. Lastly, thank you for joining us on Disruptive Dialogue. If you enjoyed this episode, as always, please subscribe, share it with a friend, and leave a review for us. Until next time, stay informed and take charge of your health. Thanks, everybody. Have a great day.